we need to understand as well. Like, there's such a taboo about talking about HIV even, and we have to understand that it's a manageable disease. I think the biggest problem with HIV is the stigma that's attached. It's the mothers that aren't feeding their children, or the women that aren't going to the clinics to get their ARVs. And I mean, if you go away with one thing from today, that you know that it is a manageable disease, and okay, if you're irresponsible, the likelihood that you would catch it is greater.
Was just brought there to kind of be put back onto a routine of taking his medication, because if a child doesn't adhere, or anyone doesn't adhere to their HIV medication, they can become resistant to it. So then they have to go onto a second line, and you only have a couple of chances of getting it right with the medication. He was there for 2 months, and he was really healthy. They were quite impressed with his health status, and he contracted TB from another baby in the clinic, and it turned out that it was drug resistant. So he's now in a chest hospital for 2 years while they're treating the drug-resistant TB. But his dad actually, his mother is in hospital with AIDS. His father is an alcoholic who would just leave him at home when he'd go to the pub, basically. So he was deemed an unfit guardian. About 3 weeks ago, or a few weeks ago, 2 aunts actually came to visit him in the Brooklyn Chest Hospital, and the care workers asked them to find a family member for him to go to stay with when he's better, and they haven't come back. So
this, you probably can't see it here very well, but this was the doctor in the prison, and they had no kind of official AIDS awareness campaign in the prison. So we went in with Living Hope Care, and just to talk to the doctor and see what kind of needs they had. Most of the prisoners have been tested in the prison. But what they were really kind of concerned about, I think, was the stigma from the other prisoners. So we just talked to the doctor about setting up kind of an education campaign.
We took people aside and we interviewed them to try and find out, just how they were, and lots of just getting their personal story basically. But out of the first 5 people that we interviewed, 4 of those people, because obviously the most common mode of transmission in Africa is through sexual intercourse. It's maybe accounts for something like 70–80% of the cases. But the first 4 out of 5 had not contracted HIV through sexual intercourse. One guy had been a barber, and he had cut himself with a razor blade accidentally. Another man had no idea why he had contracted HIV. Himself and his wife had only ever had one sexual partner, and it really kind of challenged my own perception, because you just kind of assume that's the way that a lot of the cases were transmitted. But it was just quite interesting.